Hi again. Here to do my video presentation for my root cause analysis workshop that I had with the white team with Perry and Marion McKenzie. We chose to do the case study that was given to us with the patient that was overdosed with heparin. So I'm going to do this a little bit backwards. To start off, I just want to um, evaluate the learning experience I got from this. So, I feel like I've probably recorded this a couple times and I'm always running out of time. So, I want to make sure that I have time to explain. I am a big advocate of patient safety. That's my main concern at work, always. I've worked in a medical office for 9 years and going to school to be a physician's assistant. Patient safety is at the top of my priorities. So, um, you can't help a patient get better if you're not considering the safety of the patient in the process. So, um, when I'm looking at the the topic we chose, and I thought it was a really good case study. I wish it was a little bit more detailed, but it was fun to kind of come up with some things on our own too. So, when I'm thinking about what I learned, excuse me, with the application of this tool, I learned that I like diagrams. I learned that a cause and effect diagram really does help kind of assess the root cause of a problem. I think in this situation, the root cause was not just the staff making errors. I think the staff was doing what is in a normal policy or procedure for that hospital, and the systems created errors by not letting you see a note until it was signed off on, which is kind of crazy to me because you should be able to see notes the moment that they're pending, even if they're not signed off on yet, in a normal EHR. Also, not having any verbalization, any repeat backs, anything with transferring patients. The system's lacking and not creating a culture of safety for their staff and for their patients. So, um, as a future physician's assistant, I think there's a really good learning tool. Um, it helps with my patient care, work, and personal environments. Obviously, if I see something that's happening and I need to figure out what the root cause of the problem is, if patient safety concerns are being brought up, this is something where I've experienced this at work before. We had an increase in infections after surgeries. We looked through what could be causing this out of the blue all of a sudden. It's just weird that we have all these patients coming back for wound checks, um, and when I say all these, I'm thinking like 3 or 4 in a 2 or 3 week period, but that's a lot when we weren't experiencing but maybe one a month. So we kind of got down to the root cause of it, and we had a new MA that was not cleaning patients with Hibiclens and just wiping them with an alcohol wipe. And then we were doing surgery on like skin surgery, removing atypical moles and things like that. And it was something where a little bit of alcohol was not eliminating any staph on their skin, and all of us carry staph on the skin, and that was what was causing it. So I think that something like this we could put into perspective as a provider, and it would actually help determine a root cause a lot quicker than I was able to do with my staff at work in a case like that. So I also think that um, patient care, safety has to be the main concern. You can't help a patient if you're not keeping them safe. So that's the whole point of being a provider, is to be able to help a patient. In regards to our project, I just want to go over this briefly because obviously there's a PDF that goes with it. So we looked at a cause and effect diagram. Obviously, the effect is an overdose of heparin. People, we wanted to make sure that staff was included, emergency room nurse, a cardiac floor nurse, a attending physician, because there's always an attending physician on staff, possible family members, um, environment, a busy ER, chaotic family members that are creating a little bit of chaos for the staff that are involved with helping the patient. So, and treating the patient. With communication, not having notes available to read, not having a communication between the emergency department and the cardiac floor was a big one. Lack of communication was a big deal. So in this case, um, no policies to verbalize treatment plans before transfer for the policies and processes part. No labs ran after a heparin bolus, which is kind of crazy to me, but that was missing. So. Um, and then for information systems, no pop-ups for lab draws after a heparin bolus. It's reminding you, hey, you still need to draw a lab on them to see what their PTT score is looking like. No error message when the heparin dose was exceeded. So you have a patient that was just dosed twice in an EMR and nothing came up saying, hey, this is too much. So, and then obviously no notes visible until signing this one as well, because this was a system error. So, or a system cause, if you want to say it like that. So in our effort and impact matrix, um, we chose to do a low effort, high impact by putting in a rule or a policy where if you don't sign off on your notes in a timely manner, um, and you don't call critical lab results because that wasn't called either in this case, there's disciplinary action. So write-ups, possible termination, it's something that doesn't take a lot of effort to put in a new rule, but and a new disciplinary action, but usually has a high impact because people don't want to lose their jobs, be written up, and have their coworkers see that, and so they take it more seriously. In regards to high impact, high effort, we're looking at creating a whole process improvement project, standardizing care, training staff, call like a process for critical values, a process for taking PZTs in a timely manner. All these processes are timely. So um, low effort, low impact is just pop-up reminders, signs up on the walls, um, things that can be easily bypassed, but don't take a lot of effort to put up either. And then low impact, high effort would be something like putting policies into place and taking a lot of time to write those policies, but not training anyone on how to use a new, system policy or um, like a new procedure. Not training anyone how to do the new procedure doesn't really give you good results. So that was our matrix and our cause and effect diagram and our root cause analysis project. And it was fun to do with these girls. And I look forward to another one, hopefully with them here in the future. Thanks.